Hello, this is Living Hope Clinic with your friend and partner Msonda Kasonde in health issues. We recently talked about cervical dysplasia or cervical cancer, and we talked about the anatomy of where it is and also the stages as it grows into cancer. Like I mentioned last time, I said that cancer doesn't just appear like lightning from the sky. It has got different stages, and if anything, cervical cancer, it's a cancer that has got very well-defined stages. Okay, so it has got the mild stage, it has got the moderate stage, and it's got the severe stage. The severe stage is usually called the high squamous intraepithelial lesion. When they give you such a result, it means that even the chances of your cervical dysplasia developing into cancer or progressing into cancer, the chances are high. So, and that's what will bring us now to the treatment. How do we manage if we find such? When it is in the early stages, it's not difficult to manage. That's why we are always encouraging women to have themselves checked so that we are able to catch it in the early stages. And when we catch it at that time, the treatment is very, very successful, unlike when it reaches the last stage. So today, our main topic is just now on treatment of this same cervical cancer. When you go to the hospital, definitely they will tell you to say probably you have carcinoma in situ or you have a high squamous intraepithelial lesion, meaning it is now becoming cancerous and it may even affect the neighboring organs. Okay, so there are different procedures that they can recommend if you are found wanting, and there are about 4 of them. I'll run through them. The first one that may be recommended to you is what we call the loop electrical excision procedure. This one simply uses an electric current that passes through a thin wire to act like a knife, that they remove those abnormal tissues that have grown on the cervix. So that's the first one. Usually as medical practitioners, we always want to explain a procedure of what we are going to do on you, the side effects, and also the advantages of the same procedure so that you are able to decide whether you should go for it or not. The other surgical procedure that can be recommended if you are found wanting is what we call the cryotherapy. This one is simply freezing the abnormal tissues. When we freeze them, it means we will not allow supply of nutrients, we will not allow supply of blood to that area so that it stops growing. That's one of them as well. And then we also have the third one, which we call the laser therapy. This one, it uses a narrow beam of intense light to destroy and remove the abnormal cells. It simply uses a narrow beam intense light to destroy and remove the abnormal cells. Then the fourth one that can be recommended if you are found with carcinoma in situ is what we call conization. This one, I mentioned that the cells on the surface of the cervix can become cone-shaped, and it is these cone-shaped pieces of tissue that we would want to remove. So any of the 3 that I've already mentioned, like the laser therapy, can be used. That is the beam of intense light to destroy or remove these abnormal cells. And that they can also use the loop therapy, which I mentioned at first, the loop electrical excision procedure. So any of these can be used. Now, as a patient, you are given all this information so that you decide whether you should go for these procedures or not. Now, in the event that these methods are not indicated for you, or maybe you don't desire them as a patient, we will not force it on you. So for patients who have the high squamous intraepithelial lesion, the natural approach can be used. That is using now the natural medicines. Of course, we would want to also keep monitoring you and see if there is regression or the condition is getting worse. So this one, the checkups will be every 3 months. We should be able to check and see if there is improvement or not. If there is no improvement, then we have no option, probably even combining the two. We combine with one of the surgical procedures, and also we put you on the natural medicine that would have been recommended for your condition. That's the surgical procedures that we can be able to use. And then the other thing that needs to be considered during the therapy of a carcinoma in situ is diet. It's very, very important to make sure that the diet is enhanced for any patient with any kind of cancer. Diet is very key. So we need to recommend a lot of multiple vitamins and mineral formulas that can be used for this patient. We also need to make sure that we supply the nutritional supplements that may be necessary, because it's been discovered that most of the patients that have got cancer, whichever cancer other than the cervical carcinoma, they lack a lot of vitamins. So if we did a full body scan, as Living Hope Clinic, we do those procedures. If we did a full body scan, we'll be able to identify as to which kind of vitamins and trace elements that you are lacking or that are deficient in your body, that would help the body to function properly and be able to even combat the cancer that you have. So it's very, very important that we also consider nutritional supplements and multivitamins and minerals should always be there, regardless of the stage. Don't withhold to say because it's in the last stage, there's nothing that we can do. We need to take care of our patients up to the end. The other thing that really inspires me the most when it comes to patients like where one is pronounced to have had cancer or any condition where even the books are saying there is no cure for this, you need to live with it. What other option can we do? It's prayer. Prayer also helps. It has even been validated that prayer helps when it comes to healing because it affects a number of biological processes in the body. So, when you are sick, the body itself, the way God created us, it's able to fight on its own without putting in anything. The brain and the body would know what to do and how to do it. So prayer also enhances enzyme activity. It also reduces the mutation of certain disease-causing organisms like the bacteria, the viruses, all that. And it also improves your hemoglobin levels, meaning there are people who just have naturally, they are anemic, they don't have enough blood all the time. But with prayer, it also improves because of the biological process that it enhances. Okay, and it also improves the healing of wounds. Say if we combine with any of the surgical procedures that I've already mentioned, then we combine it with prayer. Prayer will enhance also healing of wounds. And I want to tell you that not praying for the best possible outcome is equivalent to withholding an effective drug or a surgical procedure that would have even saved somebody's life. So it's important that even as medical practitioners, prayer is very key as we are managing patients, especially those with chronic conditions or those conditions that have been pronounced as not being curable because it just finishes somebody. So they need to be to heal their emotions. They need to be given some hope so that they start looking forward, not giving up. So for today, in terms of the treatment of cervical cancer, we'll end here. There are numbers that are scrolling on the screen. If you need any questions, you have any queries, please just pick any of the numbers and give us a call. We also have a Facebook page where you'll be able to watch these videos. Thank you so much for today and thank you very much for your attention. See you next time.